The second speaker will be Dr. Haytham Soliman. He's cardiologist from Jamiat Al Fayoum about cuffless wearable blood pressure monitors.
Thank you so much, and I congratulate Dr. Mohammed Salim and National Heart Institute and the whole Egyptian Hypertension Society for this elegant meeting. Can I have the presentation, please? So, our topic today, which is the cuffless wearable blood pressure monitor, if they are proven accurate, they will solve a lot of problems that we are discussing right now upon the diagnosis and the monitoring of blood pressure. And we will see the trials to improve the technology in order to have a dynamic, what it's called the dynamic monitoring of blood pressure that will help more in the diagnosis of the various types of hypertension without the fallacies and the obstruction with the cuff-based devices. So the methods of measuring blood pressure depends upon either it's invasive or non-invasive, and the non-invasive methods are either occlusion by occlusion of the vessel, the arterial occlusion methods, which are the conventional blood pressure measurement, or the ultrasound-based methods, or the non-arterial occlusion methods, which all the cuffless devices are derived from, either the pulse arrival time or pulse transit time or pulse wave analysis. And there is problems with the cuff-based devices. The proper cuff size is not always available. It has limitation in detecting hypotension and dynamic blood pressure changes. The cuff devices do not provide continuous blood pressure measurement, and even in ambulatory blood pressure, the continuous inflation and deflation of the cuff can be disturbing to the patient, especially during sleep. And that's why the cuffless devices offered or try to offer a solution for these problems. These devices can increase the awareness of hypertension because these devices are available and wearable to the common people, so they can monitor their blood pressure and discover whether this blood pressure is elevated or not. They can improve the diagnosis and the follow-up of the blood pressure. They can give us a surveillance about hypotension, especially in elderly people. And in some devices, they can alert the society and the healthcare professionals about the bouts of hypotension in these elderly people. And if they proven right, they can give a precise idea about the changes in blood pressure or the dynamic changes of the blood pressure in the patient with diagnosis or even during treatment. So what are the types of these devices? These devices are either depending on the pulse transit time or the pulse wave analysis, facial video processing, oscillometric finger pressing, ultrasound, or volume control. And we thought earlier that the photoplethysmography, which is the most popular type of these devices, is the most sophisticated. All these devices either emit actively a beam, which is either it's a photo beam or it's an electrical wave, and receive the changes and analyze these changes to extrapolate the blood pressure. In the photoplethysmography, they emit a beam into the capillaries, and with the analysis of the heart rate and sometimes the ECG, they detect the expansion and the recoil of the arterioles and capillaries to extrapolate the blood pressure changes. And then by machine learning, they analyze this wave and give us a blood pressure. A more sophisticated method is the electrical bioimpedance, which emit actively a current and then receive the change in this current guided by the ECG to analyze the waves of the blood pressure and give us a reading of the blood pressure. Another two ways is the ballistocardiography. The ballistocardiography simply it monitor the change in the posture and monitor the change that the aortic expansion and the active recoil are doing to extrapolate the blood pressure, and the seismocardiography that measure the cardiac vibration upon the chest to elicit whether this patient has an hypertension or not, or to give us a reading for the blood pressure. And there is the conventional and most simple way is by the ultrasonic waves, but this ultrasonic waves, despite it's more penetrable, but has more fallacies because it depends upon the angle of the ultrasound, the degree of pressure. So the standardization of this method is very, very difficult. And the smartphones carries all this technology. The camera of the smartphone, with the use of its flash, can emit a light source and detect the variation into the capillaries of the fingers to have a photoplethysmography. More than that, it can detect the flush or the change in the skin of the face to have a ballistocardiography to elicit the blood pressure. Smartphone accelerometer can detect the ballistocardiography, which is the change in the height or the change of the longitudinal waves or movement of the body to elicit the blood pressure. And if we place the smartphone at the chest, it can be a seismography detecting the vibration caused by the heart in pumping blood and in diastole and extrapolate the blood pressure. So the AI in blood pressure measurement is here. The machine learning can extrapolate all these information, and now the trials are with the remote blood pressure measurement by the camera of the phones or even the camera of the computers to try to measure the blood pressure. And all of this require a very simple math and physics. The process is extremely complicated. So the two types of the cuffless devices are the calibrated technology and the calibration-free technology. And we think that the calibration is comparing the device with the conventional device of blood pressure. No, the calibration or the non-calibration is inside the process itself. So calibrated devices acquire the pulse or acquire the vibration, have the signal, compare it with a reference inside the device itself, and then give us a reading. The non-calibrated or the calibration-free technology acquire the information, which is an oscillometric or ultrasound, and then give it into a process of machine learning and give us a reading or information. So the calibration or non-calibration or calibration-free is inside the device itself. And we see that the calibrated devices have more data and have more accuracy in the literature than the calibration-free devices, because it has a reference inside the device, and do not depend entirely on machine learning, because in machine learning, if you give a wrong input from the start, the cascade of machine learning will augment this wrong information to give a continuous fallacy in the readings. Of course, everything has its limitation, and the limitation of validating these devices is coming from the concept that we are measuring the static blood pressure in all our studies. So we are measuring the blood pressure at this moment. But these cuffless devices are measuring continuously the blood pressure with time-to-time variation. So the validation here is very, very difficult. There is no direct blood pressure measurement. The ideal reference is different between them. The zero cutoff point, where to start and when to end the readings, are different. And a very, very important point, which is the more clinically relevant point, is the dependence upon the heart rate. If the patient has AF, if the patient has frequent premature beats, these devices will not be able to estimate the blood pressure, because it will give you a high reading, then at the second beat, a low reading of the blood pressure, depending upon the impedance of the signals emitted from the heart. So the cuffless blood pressure is offering the conventional or the absolute blood pressure measurement and the dynamic blood pressure measurement. And the only reliable way to calibrate or to compare is by the intra-arterial blood pressure, the invasive intra-arterial blood pressure, which carry a very, very difficult task, because this will have an ethical limitation. We are subjecting the patients to an invasive method to compare. Conceptual mistake, because even the intra-arterial monitoring can have fallacies, a logistic limitation to convince the patients to have an intra-arterial monitoring, and difference in measurement between ethnicity and techniques. One of the most serious ways or trials to compare was the IEE, the Institute of Electrical and Electronic Engineering trial, which compared these devices with the intra-arterial monitoring. And they created a calibration cascade, an electronic calibration cascade, to try to calibrate these devices based upon the information they had from this trial. But overall, the most reliable meta-analysis was that of the European Society of Cardiology. They tried to group the trials that compared the cuffless with the conventional method, grouping nearly 1,000 patients, with the methods nearly of the photoplethysmography, because it's one of the most popular methods to detect the blood pressure. And they extrapolate that there is no major change in detecting either systolic or diastolic blood pressure between these methods and the conventional methods. But despite that, they concluded that the difficulty in calibrating and comparing this method, rendering them not reliable for clinical use till now. And this is clear in the guidelines. And while the FDA over the years is providing clearance for various devices to detect heart rate and blood pressure, till now the evidence in the guidelines state clearly that we cannot rely on these devices in the clinical use till now, because of the lack of calibration protocols and the lack of comparing protocols. So cuffless technology is expanding. It can provide more dynamic information than conventional methods. It's more user-friendly and less annoying. Unfortunately, it has many obstacles in calibration and validation. It requires more effort to prove clinical reliability. So till now, it cannot be used in the clinical life or the clinical practice. And thank you so much.
شكرا جزيلا دكتور هيثم. Excellent بالحقيقة. Just to ask whether to use it in diagnosis or only follow up for the future.
The trials was to use it in the follow-up because they need a reference, a solid reference from the clinical trials and the clinical aspect to compare with. So all the trials is comparing the detection, the ability of these devices to detect the elevated blood pressure and the change in the blood pressure. So although there is some trials was on volunteers, but these trials were to compare the validity of these devices and not to diagnose.
Is there a chance of increasing white coat hypertension diagnosis with these devices?
Yes. In the advancing in the calibration methods and the electronic calibration and validation methods will give us a marvelous chance to continuously monitor the blood pressure. And this blood pressure, using telemetry, the information will be automatically delivered to the healthcare professional. So the analysis will be more easy to elicit whether the patient has white coat hypertension or muscular hypertension without tension. He is wearing a device that emitting the blood pressure status all over the day or all over the week without more sophistication.
Excellent presentation دكتور هيثم as usual. حقيقي الكافلس ديفايس جايه مكتوبه بقى في الليتريتشر في التشالنج بتاع الاوبيستي. الاوبيستي مش التشالنج بس اللي هي improper cuff size. في some obese patient has conical shape arm. proximal part بيبقى السيركمفرنس اعلى من الديستال. وأمرن بره عملت adjustable cuff for this patient. ولكن في الليتريتشر بيقول لك ان الفيوتشر for solving this problem is cuffless device.
Yes, but mind you that there is also a limitation at the type of skin in this patient. The more thick the skin, the more intense you are requiring to send a beam and to receive the beam. And this is one of the limitation of the cuffless devices. In dark skin patients, in patient with thick skin, in patient with scleroderma, the impedance of this emitted pulse is huge. So this is one of the limitations they are trying to solve, especially with the video analysis, because this will not depend upon the thickness of the skin.
Many thanks, Dr. Haytham,
Thank you so
for
much.
this fruitful presentation. Many thanks.
Thank you so much.